So thank you very much, ladies and gentlemen. My name is Julius, and I'll be introducing the resource person for today's presentation. He's a very astute medical doctor with over a decade of practice of medicine, up his sleeve. He's very passionate about delivery of quality health care and also educating the public on health-related issues. He's particularly interested in health coaching, which literally empowers people to live healthy lifestyles as a way of preventing diseases. Now, he's not a boring person. I mean, in his free time, he loves to play tennis, and he also loves to listen to good music. So, ladies and gentlemen, it's my honor to introduce to us Dr. Michael Kwaffo to help us with today's presentation. Believe me, you will love this presentation and you will learn a lot as well. Dr. Kwaffo.
Thank you very much, Julius. Thank you. Appreciate it. Okay. So let's talk about the liver and hepatitis. Good afternoon, ladies and gentlemen, and thank you for joining us to inform ourselves. We need to be informed. When you are informed and you have knowledge, you can make good decisions for your own health. We're in the age of information. There is good information out there, but there's also misinformation and bad information. And when you are not well educated, sometimes you are unable to see through the misinformation. It might lead you to make some decisions about your health, which can affect you. So welcome, and let's get to it. Abigail, could you put this in presentation mode? I know we're having difficulty earlier.
I actually did. I'm not sure why. Bear with me.
Okay, whilst we are sorting that out, today happens to be World Hepatitis Day, July 28th. Happens to be World Hepatitis Day. Hepatitis is very, very important. Yes, it's still not in presentation mode.
Kindly carry on, I'll figure it out.
Okay, all right, thank you. So we'll talk about the liver, talk about how the liver works and what a normal liver should be doing. We'll zoom into hepatitis. What is hepatitis? What are the causes of hepatitis? If you want to know your status, what to do. If you want to prevent hepatitis, what to do. There are some causes of hepatitis that we will talk about, and how to prevent. Yeah, I mentioned that. And overall, how to maintain a healthy liver. Okay. A few seconds to sort this out. Sorry about that. Technology sometimes fails us. Okay. All right.
Doc, is it better?
Yeah, this is okay.
Yeah.
All right. So could we do the next two slides? Okay. I can see that's in PDF. All right. So the liver. Where is the liver located? It's on your right, upper right abdomen. When we talk about the abdomen, yes, touching your belly, that whole space is your abdomen. And the liver sits on the top right corner. All right, top right corner. That's where the liver is. It's divided into two. There's a left side and the right side of the liver. And the liver, that's a lot of important things in the human body. Now, it's your liver that detoxifies. When we say detoxification, as we go about, we are eating all kinds of things within our food, and within the things, the drugs that we take, anything that enters your body, it goes into your stomach, it tries to enter your bloodstream. The liver is the first point of call. Anything that is bad for your system, your liver tries to remove the bad parts out and then throws it out of your body. So the liver does a lot of detoxification. All right. Now the liver produces very, very important proteins in your blood. Now these proteins, there are different, so many different kinds of them. And the proteins do a very wide variety of things, including immunoglobulins. When we say immunoglobulins, they are the kinds of proteins that help your immune system to work. So imagine your liver isn't working well, you will not be able to produce, you wouldn't have a strong immune system. So the liver is somehow is part of the immune system. Now, the liver also checks the level of glucose and fats, cholesterol levels in your blood. That's what the liver does. It maintains glucose levels. For instance, if you were starving, whenever you are fasting, your liver ensures that you don't die. The liver constantly releases glucose into your blood. Without your liver, you would have very low blood glucose and you could just collapse because of that. Also, the liver balances cholesterol levels. Okay. The liver makes good cholesterol. They actually makes them fresh. So we are eating some, but the liver also makes some. So that is part of what the liver does. I already mentioned that it regulates your immune system. Now, the liver also does a lot of storage. A lot of the vitamins that we need for our body to work, vitamin B12, folic acid, all these vitamins, the liver ensures that it stores enough for you. For instance, vitamin B12, folic acid, you have enough stores of them for over a year. The liver always ensures that you're having more than enough. Okay. Now, the liver also helps with digestion. If your liver is not working well, you can't produce bile. Bile is a chemical that helps, digestion to go on smoothly. So without your liver, you would have a problem. You would have a lot of digestion issues. Okay. Abigail, I think we lost you. Okay. So the liver does all these useful things, and you rely heavily on your liver to work well. Now, what happens when the liver decides to not work well? Now, the liver is a very, very, very resilient organ. Just like your kidneys, your liver can take on a lot of insults. You can punch the liver will try and then maintain its function without complaining. So the liver is able to. There we go. Can you hear me? We've lost you.
Hello, Doc. Yes, I can hear you. You can't see my screen?
No, please.
Please bear with me. Apologies for that.
No problem. Okay. Let me just go on a bit so that when the screen comes, we can. So I was mentioning that the liver does a lot of very useful things, and the liver is very, very resilient. Now, if you should have a problem today with your liver, yes, you may have symptoms that will draw your attention to it. But there are lots of problems that go unnoticed because the liver doesn't tell you about it. The liver will just manage it. The liver could just be there trying to manage the situation. So it's a very resilient organ. When it gets hit, it quickly tries to recover. It's well able to cope with stress and injury for a very long time. Abigail, let's do slide 4. Right. Okay. So when we're trying to assess how the liver is working, there are two ways, and both of these ways must be done. We want to make sure that the liver looks fine, and how we take a look at it is through ultrasound. It's a very simple test. They put some gel on your belly, and then they go scanning the liver. So the liver must look fine. I mentioned that the liver is able to take a lot of stress. Sometimes the liver will appear fine on test, but when we look at it, we see that no, there is a change in how it's looking. It's not looking as fresh as it should. So it's important that if you're trying to evaluate your liver, you do a liver ultrasound scan, okay? And then you also check the function in the blood. We do what we call liver function tests. We check all the things the liver is supposed to do, and then we see the levels within the blood. So the liver must look fine and must work fine. Next, please. So I mentioned earlier that the liver is very, very resilient and highly regenerative, okay? And so for that reason, it's able to deal with a lot of chronic injury for a long time while still maintaining normal functioning. And this is a problem. Sometimes you prefer to address situations head on, be aware of situations, but the liver will probably keep you, not in the know, and then will be trying to work to solve the problem. It heals itself, it gets hurt, it heals itself. And sometimes before you are aware, it has lost a lot of function. So usually about 60%, 80% of the function gone, that is when you start beginning to have symptoms, and that might be late. So screening is important. All right, next slide. So there are threats, things that can threaten your liver. We need to know these threats. If you know your enemy, you can begin to be aware of them and then take steps to try and prevent your enemy from getting you. So these are the threats to liver function. Abigail, we've lost you again. Okay. So that's why we're here to talk about hepatitis. Hepatitis simply means, let's do slide 6. Hepatitis simply means liver inflammation or liver injury. Okay. When we say hepatitis, what is hepatitis? Hepatitis is liver inflammation. Inflammation means injury, tissue injury. Something has hurt the liver. So that is hepatitis. Okay. Hepatitis is liver inflammation, liver injury. But there are several causes of it. There is not one cause of hepatitis. There are several causes of it. Hepatitis can be acute. Acute means that it has happened recently, within a period of 6 months. It has happened recently. And the other one is chronic. So you have acute hepatitis and then chronic hepatitis. Now, this chronic hepatitis I talked about, it's what would lead to gradual, progressive liver inflammation, liver injury, and then at the end of it, your liver has become so scarred. All right, it cannot work any longer because the real liver tissue has all been messed up because of the long-standing injury. Small injury, then it gets, the liver will heal. Small injury, liver heals. Then more injury, the liver heals. When that happens, there's a lot of scarring within the liver. So if any of you has heard the term liver cirrhosis, that is like the end stage, the very last end, after the liver has endured a lot of pain and suffering, usually in silence. The end is liver cirrhosis. So we're going to talk more about all the things that can threaten your liver, the major ones. Once you know what the possible threats are, you will be well placed to reduce the risks to your liver. Your liver must last you a lifetime. All right, next slide, please. So these are the common causes of hepatitis, or the common threats to the liver that we should all be aware of. The first one is infections. There are germs, mainly viruses, okay, that you can acquire. You're not born with them, but you can acquire them. You acquire them sometimes from childhood, soon after birth. Yes, there are some infections that are lurking as soon as you are born. They are waiting for you. So we'll learn about them. There are some infections that can, threaten your liver. All right. Viral, bacteria, parasites. We need to know about these. So these are infectious causes of hepatitis. Now, the other one is alcohol. This will be the most interesting part of today's presentation because it always brings out a lot of questions. Every people like it will be, I can guarantee that people will ask questions on this one. How much alcohol is enough? What is moderation? All right. So alcohol is a major cause of, hepatitis, liver inflammation, and it's a major threat to your liver, and you should know about it to be able to make the right decision for yourself. The next is fatty liver. There's a condition called fatty liver. The liver is just full of fat cells, okay? Usually from metabolic problem. Metabolism really refers to how your body is using energy, calories, how your body is processing things, okay? So we'll talk more about that as well. Another threat to the liver is drugs, herbs, herbal stuff, things, because I mentioned that the very first thing, the liver detoxifies. That is the liver's job. So anything that is entering your body, if it is bad for you, the liver will take the first hit. The very first thing that will suffer will be your liver. The liver will try its best, will take on the injury. Sometimes it will take some, and then the rest will go enter the system and do more damage. But the liver usually, if you are taking some herbs, supplements, drugs that are bad for you, your liver usually suffers for it first. Okay. Now, these are less common, but they are there. We should be aware of it. Liver cancer, we are seeing it on the rise, especially because of the infections. Okay. If you have some viral infections like hepatitis, they predispose you to liver cancer, and you should be aware of them. Okay. Now, the liver has another small organ close to it called the gallbladder. If you have a gallbladder problem, it can also affect your liver. And finally, autoimmune disease. The ones I've highlighted in red are the commonest ones. They are so common, everyone should know about them. These are common threats to your liver, and you should know about it and take all the steps to reduce their effect on you. Okay, so next slide, please. So if there should be something wrong with your liver, if something should be wrong with your liver, what are some of the signs that, or the symptoms that you may have? Now, these symptoms are not entirely always related to the liver. There are several other things. The first is jaundice. Jaundice just refers to your eyes turning yellow. Sometimes if you are very fair, your skin, your palms, you can see that no, it's all turning yellow. Okay, it's because the liver's job of detoxifying is slowing down. So some of the toxins that the liver works on, it's going into your blood and it's coloring your blood cells and your tissues. So jaundice, some people say jaundice. It's not jaundice. Okay, it's jaundice. So jaundice simply means your eyes, your skin, your palms are turning yellow. When that happens, it may indicate that no, there might be a liver disease. Now, there are some other problems that will give you jaundice, not necessarily from the liver, but commonly, if you ever see your eyes, palms turning yellow, you need to report to the hospital. There's something going on. You can also have pain. I mentioned the liver is in the right top corner. Okay, right top corner of your abdomen. If you're having severe pain on that side, it could be the liver. There are other organs there as well. The gallbladder is there. So it's not always the liver. But if you have sharp, severe pain, which is persistent in the right top part of your abdomen, talk to your doctor, let your doctor take a look. Now, some of these symptoms only happen when the liver is well advanced. Liver damage is well advanced. So, for instance, a swollen abdomen is not just pot belly. I mean, a swollen abdomen, your abdomen gets swelled up, is because the liver is unable to balance things very well, and then fluid begins to accumulate in your abdomen and in your legs. So, swollen abdomen, swollen legs could point to liver disease. There are other things as well that give a similar picture, and it's not always attributable to the liver. Now, if your liver is failing, you may begin to vomit blood. Yes, you may be vomiting blood, or you can see that your stool, your toilet turns to almost like coal tar. If ever you see, I recently met a patient who had been seeing coal tar stools, black tarry stools for a week. They didn't know what it was and was walking around. That signifies bleeding. If ever you should see dark tarry stools, you should report to your doctor. Now there are some, if you are taking iron pills and mojadro, it can give you dark stools. Don't worry about that one. That is just iron being broken down. But if you're not on any iron supplements and your stool turns dark and tarry, please report to your doctor. Now, if your urine also turns dark, it may also point to a liver disease. And finally, you are just itching from head to toe, scratching, severe itching. Now, there are other causes of itching, generalized, but it may be due to a liver disease. So your doctor must take a look, examine, and then make a decision on that one. So these are some of the signs and symptoms of liver disease. But I've mentioned that the liver is resilient. It will just keep quiet. Usually when the problem is in its early stages, for years, you may not see anything. So these signs and symptoms may appear very late, and that is a problem. Okay. All right. Next slide. So we'll start with the viruses. These are infections, and these infections threaten your liver. They are number one threat to your liver, especially in Africa. It is very common. So we see that it's hyper endemic here. Okay, it's very common in Ghana. We are estimating between 9 and 12%. If you take every 100 people, about 12 of them would have hepatitis B, okay, virus hiding in their liver. There are different types of hepatitis virus. There's A, B, C, D, and E. But the most important of them that cause problems is B and C. Okay, B and C are the troublesome ones. So we'll talk more about them. Okay, they can cause acute infections or acute problems, meaning that they can come and then hit your liver so hard, you may have signs and they will completely resolve. Yes, you can have hepatitis B today, and within 6 months, your body clears it completely from your system. If that should happen, you are lucky, because it leads you to have permanent immunity. If you get hepatitis B today, and after 6 months, your body has dealt with it completely, it leaves you with permanent immunity, meaning that you are completely immune and you cannot have it again. So that is with hepatitis B when it happens acutely and your body is able to recover from it. But unfortunately, most of the time, it leaves a chronic infection, meaning that your body is unable to clear that virus, and the virus hangs on tightly in your liver. If after 6 months you've had hepatitis B and you still have hepatitis B after 6 months, what it means is that unfortunately you've had a chronic infection. Chronic means that it is with you for life. Chronic, chronic, chronic. So I've mentioned that the two important viruses are B and C, hepatitis B and hepatitis C. Now, they can enter your body through various ways. We'll talk about how they are transmitted. When it enters your body, when you acquire those viruses, two things may happen. You can have an acute infection, meaning you will have the infection and within 6 months, your body will deal with it. When that happens, after 6 months, you'll be negative. But when you go and check your antibodies, you have immunity, antibodies to hepatitis B, never to have it again. Now, most of the time, it doesn't happen as an acute infection. Most of the time, it happens as a chronic infection, which means that when you acquire it, the virus enters your liver and takes a very good seat in your liver. It will never leave. No matter what you do, it will never leave you. Okay, we'll talk more about it. It's a very controversial thing. And hepatitis C also tends to have a chronic cause. So these B and C, the reason why they are important and troublesome is because of this chronic thing I'm talking about. They tend to be chronic, and they stay with you for a very long time. All right, next slide. So B and C, why are they important? I've mentioned this already, that they tend to be chronic infections. You cannot get rid of them. You just cannot get rid of it. You shake it, shake it, shake it, shake it, shake it, shake it. The virus has a way of entering into your DNA, the DNA of the liver, and decides that no way, I am not going. Okay? But it is not the end of the world. There are things that we look out for.
Kindly bear with us. We're trying to get back Doc back on the line. Please hold on for us. Hello, Doc.
Hello.
Hello, Doc. Yes, we
Yes.
can hear you now.
All right. All right. Sorry about that. Let me do this again. So I was saying that hepatitis B is like HIV. When you get it, you sort of cannot get rid of it. Your body, it enters into your DNA. That's the nature of the virus. Very smart virus. Okay, it enters into your body and becomes a chronic infection. You can manage and control it. We have medications that will suppress the virus, prevent the virus from multiplying. But the virus has a way of entering into your system and your DNA. It becomes almost one with you. Okay, hepatitis C does similar, but we are able to cure it because it's not a DNA virus. We can cure hepatitis C completely from your body. But hepatitis B has become a very tricky virus to completely get rid of. Okay, we'll talk more about it. Not everybody has a very big deal with hepatitis B, even though it has a chronic cause in their body. So B and C are very important because of this reason. Now, they are transmissible. B and C are transmissible only to non-immune individuals. I'll highlight this very well, non-immune. The reason why we are talking about World Hepatitis Day and making so much noise about hepatitis is that it's very common here. Now, if everybody got immune, immunity means that you have antibodies, your body has protection. If everybody has protection, hepatitis B will not be able to jump from person to person, such that when the last person who has hepatitis B dies, then we would have been able to get rid of hepatitis B. Theoretically, it's very possible, because if hepatitis B wants to jump, the reason why it's just we can't get rid of it is because it's moving from person to person to person to person to person. Okay. Now, if it's tried to move to me, I'm vaccinated against hepatitis B, and there's no room for it here. It tries to go to the next person, there's no room. To the next person, there's no room. To the next person, there's no room. Then, when the last person who has hepatitis B dies, we would have gotten rid of the virus. So, immunity is very important. It can only enter into the body of somebody who is non-immune. So, are you immune or you are non-immune? That is a question for you. How can you find out? You can do the tests for it. You check for your hepatitis B status and immunity levels. Some people have had the virus in the past silently, and then we can see that, oh, bro, you have immunity. Say, oh no, I've never been vaccinated before, but you have immunity. And then we check and say, oh, okay. It shows that, yes, you've had the virus before, but you are lucky. Your body was able to quickly deal with the virus and produce immunity to it. And hence, you don't need to be vaccinated even, because your body has full immunity from a natural infection, we say. Now, some people are completely non-immune. They are just walking around. They are fresh. They've never seen hepatitis B before. And the virus is looking for you. The virus is looking for all of you. Those of you who have never had hepatitis B before, the virus is looking for you. You are all non-immune. You've not had vaccination, and you have not had the infection before. You are the ones we are trying to talk to, so that if you all get immunized, anytime the virus is trying to enter your body, say no. The next person, no. The next person, no. We are all immunized. So the last person living with hepatitis B, maybe in the next 20, 30, 40, 50 years, will die. We've gotten rid of it. The virus has no place to go because everyone is immune. Another reason why it is important to talk about is that in our part of the world, the common way the virus transmits is from mother to child very early on, okay, in the first few years of life, first 5 years of life. So women play a very special role with hepatitis transmission. In Ghana, that is the number one. Not even sexual intercourse compares to this. When mothers have hepatitis B, if steps are not taken, it is almost certain that the child that is born will have hepatitis B. Not necessarily through the uterus, that is through the womb, no. But the first few years of life, because the virus lives in bodily fluids, a close relationship, mother and child bond will typically get the virus to be transmitted in this manner. Okay. Another reason why hepatitis B and C are very important viruses to talk about is that when I say chronic, they live with you silently and they are hurting your liver slowly. So it's a slow injury. Okay. It's holding on very tightly to your liver. It's a very slow damage, and it will not end now. It can take its time, 30 years, 40 years. The liver is just trying to cope, and then it finishes off the liver. When the liver is done, the liver is just full of scars because it was trying to cope and you were unaware. So it's very important to know your status, know your immunity levels, and then if you are non-immune, you are the ones the virus is looking for, get yourself immunized. Okay, this is the essence of World Hepatitis Day. We want to end hepatitis infection, hepatitis B infection, hepatitis C infections. All right. And liver cancer, hepatitis B is a very, very important cause of liver cancer. It alters the DNA of the liver in a lot of ways that will predispose you to have liver cancer. So we want to end hepatitis B, and this is how we will do that. Next slide. So this is a cartoon I got online, just trying to let you understand that the relationship between these viruses and the liver is so toxic. The virus loves the liver, is holding on tightly, and it says that I can't let you go. I'm in love with you. Please be mine forever and ever. The liver is crying, but it just cannot shake off the virus, and the virus is just holding on tightly in love. See the love. Okay, so that is just on the lighter note. The reason we've talked about is just to highlight that it's a chronic. Usually they tend to be chronic. You can have an acute infection and your body would manage to deal with it if within 6 months your body has dealt with it, then it was an acute infection. We can't know up front. We manage and then we wait and then we see. Okay, and I say that we cannot cure hepatitis B, just as we cannot cure HIV infection, because it's a very special kind of virus. It is a DNA virus. It enters deep into your DNA, but we can suppress it and then keep it quiet, shut it up into a corner that it cannot, come out. Okay, with medication. All right, but hepatitis C is curable. If you have hepatitis C, that is curable. Okay, we have medication that can completely cure it. All right, next slide. All right, so I've talked about some aspects of transmission. How do you get hepatitis B? How is it transmitted? I've mentioned already that in Ghana, it's not even sexual intercourse. It's a way of transmission. But in Ghana, majority mother to child transmission, especially before age 5. So I would say that especially women here, childbearing age, you should be very interested in your status. If you're positive, no big deal. There are steps that can be taken to ensure that your children are safe. Okay, it's a very important way. If we're able to test, so in Ghana now, we test all pregnant women. If you are pregnant, you do hepatitis B test. Now, when you do it and you are positive, we will monitor you. There are a few tests we'll do to check and see your liver function, how it's doing, how it's working. If during delivery, as soon as the baby is born, we would immunize the baby, give the baby protection to reduce the risk of mother to child transmission. Sexual intercourse is a way that the virus can be transmitted. But we have seen so many times a husband is positive, the wife is negative. They've been married for over 30 years and the transmission hasn't happened. It's a very important way it transmits, but mother to child transmission far outnumbers it. Okay. And typically, because of the mother to child transmission, it happens in households. If you are positive, tell your siblings to check. Some people check and all their siblings are positive, and then they go and tell their mother, and the mother goes to check, and she's been positive all along, and she'd been giving it to them, and they didn't know. Back in the day, we were not aware of these things so much. Now, infected needles and sharp objects. If you're going to get surgery, if you're going to get tattoo, piercing, and they are not they don't follow protocols. There are protocols that will sanitize and sterilize, complete sterilization of things. If protocols are not adhered to, these are ways that you can get hepatitis B, because if you use the device, the sharp object, the needle, whatever tool it is, on somebody who has hepatitis B, if you should use it on the next person who is non-immune, you can transmit the virus. Now we've seen clearly that skin to skin contact, shaking hands, hugging, okay, saliva, tears, sweat, urine, even though they are bodily fluids, they have not been implicated when it comes to transmission of hepatitis B. Okay, so we do not highlight it really as a cause, even though, yes, we know that the virus can be transmitted through bodily fluids. These are very, very unlikely ways, and we do not, they are not implicated from research. These are not implicated in transmission. Next slide, please. So I've talked about, yes, hepatitis, acute and then chronic. So acute is less than 6 months. Chronic means that it's been going on and will stay with you for life. Next, please. Good. So if you have the virus enters your body today, two things can happen. It can become acute, where you would feel the full impact of the virus. You will be very sick, very, 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 very sick. You would have the symptoms, the pain, the right top corner pain. Your eyes will turn yellow. You will feel feverish, like you have malaria, vomiting. Okay, it can be very, very bad, acute hepatitis. And once that happens, your body tries to heal. Sometimes, if you get it as an adult, most likely, you may have symptoms and your body would gradually try to recover, and it's able to recover. When that happens, you get full immunity to hepatitis. But when you get it as a child, unfortunately, if you get hepatitis B as a child, it becomes a chronic thing that lives with you for life. And you become a carrier. You are just giving it away to people. You can spread it easily. You are a carrier, and then you are passing it on. You are infectious, passing it on through bodily fluids. The mother to child transmission I talked about, through sexual intercourse, If you are sharing sharp objects and needles and stuff like that with people, you may pass it on to others. Okay. All right. Next, please.
They don't know why I'm sick or how to fix it. Give them the treatments a chance.
So get tested today. Today is World Hepatitis Day. Be aware of your status. If you do not know what is your status, it's very, very endemic, very common in our part of the world. Just walk into any lab, SYNLAB, and then yes, SYNLAB is a good choice. If you don't have SYNLAB, any other lab that's close to you, get tested today. It's a simple test. But go up further. Sometimes you test, you are negative, but if you were to do the full profile, we call it profile, you will see that, oh, you are immune. You are negative, but you are immune, meaning that you do not even need vaccination. What happened? It means that you've already had the virus in the past. You already came into contact with it. You were lucky. Your body recovered fully, and then it gave you immunity. So anybody who tests negative with the hepatitis test and goes on to check their immunity levels and sees that, oh, they've never been vaccinated before, but they are immune, then most likely you acquired it and your body dealt with it completely. So do hepatitis B test, do hepatitis C test. These are the commonest infectious threats to your liver, and know your immune status. Okay, so test for hepatitis B, test for hepatitis C. Now, immune status. Some people have been immunized, but the immunization didn't work. Yes, you went in for immunization for hepatitis B. There are 3 shots. Okay, 3 shots, usually a month apart, that you should take to get you lifelong immunity. Some people went through all, but unfortunately, there was a problem with the immunization, and the immunization didn't work. So you are walking around thinking that, oh, I am immune, but you are unaware that unfortunately you are non-immune. You are a target. All right. So if you've ever been immunized before and you've never confirmed your immunity, I would advise that yes, know your immune status. Okay, spend a few Ghana cedis. These are not very expensive tests. Spend a few Ghana cedis on yourself, on your own body. All right, and know your status and take the necessary steps. If you are non-immune, please get vaccinated, because you are a target. The virus is looking for you. If it gets you, it will love you till the end. All right. Okay. Next one. So yes, so get tested, get immunized. There's immunization for hepatitis B. Hepatitis C is curable. If you have hepatitis C, it's curable. There's no immunization for that one, but you can get vaccinated against hepatitis B, which is much more common in our part of the world. Hepatitis C is not very common. It's there, but it's not very common. All right, next slide. Good. So if you are positive, what next? Okay, it's not the end of the world. Anyone who has hepatitis B positivity, it's cool, no problem. Now, when you have the virus and it is chronic, meaning that you do it now, it's positive, 6 months is positive, it's chronic, it's not going anywhere. You have to live with it. Your doctor will do some further tests and assessment, because not everybody who has hepatitis B should even sweat or worry about it, because actually majority of people who have hepatitis B, they will live with the virus, grow old to 100 years and die from heart attack, and not hepatitis B. So yes, hear me well, majority of people who have hepatitis B will live with them, and they will live with hepatitis B in a very amicable relationship. the virus will stay there and will not be destroying their liver. The virus is just wants to be with you. That's all. Okay, it will not destroy your liver. Majority of people. Okay, so a minority, okay, about 10% of people, when you take all those who have hepatitis B in this country, most of them have it and have been living with it and will continue to live with it without any problem. But there is a minority of them, about 10% of those who have hepatitis B. The virus is living there and it is giving them problem. Small. The virus is living with you. Oh, I love you. I won't do anything to you. But the virus is lying. It is gradually hurting your liver. Your liver is also trying to fight back, trying to recover, but it's doing a bad job at the recovery. They hurt, they repair, they hurt, they repair, they hurt and repair. If it continues for a long time, the liver. Hello?
Yes, Doc, we can hear you.
Okay. So I was saying that majority of people do not need to bother really about hepatitis B. And how can we tell those who need attention? Okay, the minority of people who the virus is hurting, those are the people that we are looking for, because we are looking for everybody. Okay, we want to identify everybody, know those who have hepatitis B, those who don't have hepatitis B. Those who don't have hepatitis B, if you are non-immune, please get immunized. Now, those who have hepatitis B, what next? Out of those who have hepatitis B, majority of them, they are not being hurt by the virus. The virus is living there, but the virus, your immune system has sort of controlled the virus. The virus is also obedient. It's listening to your immune system. It's not trying to be aggressive. It just wants to stay there with you. That's all. A minority of people, the virus is just there, but it is attacking your liver and hurting your liver, causing inflammation, step by step, slowly but surely. Now, as doctors, when somebody has hepatitis B, we need to tell these groups apart. We need to tell, are you the type that the virus is just living peacefully with and, not really being aggressive? Your immune system has kept the virus in check. Or are you the type that the virus is there and is working some injury in your liver? Slowly is hurting your liver. Okay? So when somebody has hepatitis B, some tests must follow. First, we do what we call a viral load. We check what is the population of the virus here. Okay, we look at certain factors, your age, okay, and what the population of the virus. Some people have 1 million viruses living in their body, 5 billion, okay, and somebody has 20, 100, 300, 400, 1,000. There's a difference. We put all this information together and then we say that no, the way things are going, you are likely going to have liver damage, gradual liver damage, and hence you will benefit from treatment. Okay, so we do the viral load. We check your liver function to try and track, is there inflammation in the liver? We do the full hepatitis profile. We call one thing E antigen. It tells us the nature of the virus. Is this virus an aggressive virus that is always multiplying, or this is a very gentle virus? So we need to know more about the virus a bit. And then we also scan the liver. How is the liver looking? Rarely we do what we call a liver biopsy. We go to pinch a bit of the liver and see what's going on in there. So if you have hepatitis B and you've never undergone these tests to try and see where do you fall? Are you the one who has chronic inactive hepatitis? The virus is inactive. It's just there. It just wants to be with you. No damage. Your immune system is also checking the virus. The virus is just chill. Very, very obedient virus. Or yours is the type that is a bit more aggressive. The virus is, a bit aggressive and it's causing liver inflammation. So we try to tell these groups apart. When I say not everyone will benefit from treatment, what I mean is that, yes, I've already said that some people have the virus, they will live to 100 years, 120 years. The hypertension that you have, the diabetes that you have is what you should be concerned about. Forget about hepatitis B. It won't worry you. As for you, the virus is living comfortably with you. Now, if you go and give such a person medication to treat hepatitis B, already this person did not need it. Okay, but yes, you have exposed the person to potential, okay, it's not guaranteed, but there are potential adverse effects from the medication. So not everybody who has hepatitis B needs to be treated. A lot of people are panicking. They panic about hepatitis B. Say, hey, I have hepatitis B. No, it's not the end at all, because like I said, majority would have the virus and would live comfortably with the virus, and it goes away and they are fine. Sorry, it doesn't go away. They live with the virus and they grow old, die from something else, and not hepatitis B. So such a person will not need treatment. Okay. However, those who need treatment are the ones who we check, they've got a very high viral load. We are seeing traces of liver inflammation. Okay, we do the ultrasound, the liver is not looking sharp, it's looking some way, and then sometimes we do a biopsy. So we put a lot of factors together, and then we tell you, please, this is where you are. Now your position can change. Some people can start well, they don't need treatment, and then the virus along the line changes its attitude. Okay, or your body, your immune system becomes weakened by something else, and that causes a problem. The virus now becomes a bit more aggressive, greedy, and wants more, and begins to damage your liver. So your position is not permanent. We also continue to monitor. 6 monthly, we review, we check and see how are things going. All right, slide. So I've already mentioned hepatitis B is not curable because it's a DNA virus. It enters deep into your DNA. Okay, but we have medications to completely suppress it. Okay, completely suppress it to make it inactive so that the virus does not, damage your liver. Hepatitis C, however, is curable. All right, next slide. So that will bring us to the end of the talk with the viruses, the hepatitis viruses. Now, the alcohol matter, I'll keep it simple because this one, I know that questions will come about alcohol. Okay, so alcohol and the liver, there have been different over the years. Some people say, oh, no, Mr. Christ, okay, it's good for your stomach. People will even quote the Bible. Yes, they said Paul told Timothy that you drink small because of the stomach problem. No, alcohol is good. So people are basing on that. They say, oh, more. It goes into the Bible. The Bible has, all right. So there are people who quote it just to, but alcohol is problematic, it's troublesome. The line between okay levels, how much is okay, how much is not okay. Alcohol gives pleasure. People drink for fun. People drink alcohol for different reasons. Okay, so it's tricky. Now, as doctors, we try to put a cap on it because you cannot necessarily stop people from taking alcohol. If you do that, nobody will come to your hospital again. Yeah, this doctor, why? Small drink that we want to drink, allow us to drink. So something must kill somebody. All right. So from research, what we find as acceptable, we try to quantify and say that, okay, we quantify alcohol in terms of units, and say that, okay, one bottle of beer, okay, is like a unit of alcohol. If you spread it across a week, 7 units, that means 7 bottles. Some people say, hey, doc, but that's it. 7 bottles a week is okay. Benyano. Okay, let me not say the story. But yes, we try to quantify and we place a cap around 7 units of alcohol as a safe level. Me personally, because of what we have seen, I do not encourage the spirits. Okay, I do not encourage the spirits at all. 1 shot of spirit is also one unit. So a bottle of beer is 1 unit. A shot of spirit is also 1 unit, which will mean that if you spread it across 7 units, 7 shots within a week, may be considered safe. But the liver also has enzymes that will try to handle alcohol. Alcohol is not beneficial to the liver at all. No. Alcohol does not benefit the liver in any way, but because it is somehow a toxin, the liver is the very first thing that deals with alcohol. And the liver has a mechanism to deal with alcohol, but this mechanism is different for different people. So the fact that we say these things as, 7 units of alcohol, a glass of wine is also a unit, meaning that yes, 7 small glasses of wine spread across a week is fine. 7 bottles of beer spread across a week, 7 shots of, even though we say these things, we are careful because your liver, what your liver can handle is different from what my liver can handle. So I know people who drink well, shots of spirits, gin, they do the real stuff, 40%. Yet they are fine. Their liver is completely fine. There's no trace of, liver strain at all. And some people try the same thing. And unfortunately, we see that, no, there's a lot of strain on your liver. So different people have different. If you can avoid it, avoid it. If you can minimize it to the barest minimum, occasionally, because I said that drinks are also, somebody is doing his thoughts. Okay, I know questions will flow out of this one. If you can avoid it completely, avoid it. That is completely unacceptable to somebody. Say, hey, how? It is completely not possible for some people. If you can avoid it because it has no direct benefit. That statement that a glass of wine is what's good for the heart is not. It's been debunked a long time ago. Now new research is coming out that is saying that no amount of alcohol is safe. Alcohol is just bad. Okay, yes, there are brain effects of alcohol. There are cardiac effects of alcohol, nerve effects of alcohol. Aside the liver, alcohol is something that, if you can do without, do without. But as long as you're doing it in moderation and your body can handle it, once you go and do your checkups, there are no signs of liver strain. It's okay. All right. So I'll end the matter here, but I know the questions will flow, so it's okay. We'll handle the questions when they come. Okay. All right. Is there any pastor on the call? Maybe it might enter into the realms of religion. So that's what alcohol always brings about controversy. All right, next one. Now, this is a very, 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 very important cause of liver disease. It's a huge threat. And I want everyone to be aware of this. Now, some people don't drink anything. They don't have hepatitis B, they are immunized. But when we do the liver test, we see that no, the liver is looking some way. The liver is inflamed. Okay, the liver is injured. It has a problem. The liver is not smiling, it's not happy. And it's because of what we call non-alcoholic fatty liver. Alcohol can cause fatty liver, fatty changes in the liver that causes inflammation. But some people don't drink alcohol, they don't do anything bad, yet they are having fatty liver disease. Now, what is it? It's something that comes from what we call it's a metabolic disease. Metabolic means that the way your body handles calories, the way your body handles food, glucose, energy, lipids, cholesterol has changed. Okay. And you are tending to storage. You are over storing glucose and fat. It's very common in patients who have diabetes, okay, and also common in people who are overweight. If you are not watching your diet, you are eating anyhow, you are gaining weight. If you are gaining weight a bit too fast, you could have this metabolic disease called non-alcoholic fatty liver disease. However, it's reversible. Usually, once you get your metabolism fired up, you are exercising, you are eating right, you've lost a couple of kilograms, okay? You are keeping in shape. These changes reverse, but they can also progress. Okay, earlier on we were fatty liver, but we have seen that no, fatty liver is also dangerous, and gradually it causes liver inflammation and scarring. So it's a very important cause of liver inflammation, which you should be aware of. Exercise, please. We do not exercise as much as we need to. It's very important because it gets your metabolism going. You prevent hypertension, you prevent diabetes. Yes, you can prevent these things through keeping a very healthy lifestyle. All right. Diet and exercise, very, very important. I always say that it's not enough. When you are less than 50 years, you have no business saying that you are walking as exercise. If you're less than 50, your exercise should be more than walking. Okay? Because walking is for the 50 plus, 60 plus, they can walk small. But if you are young, okay, less than 50, you should be doing much more to get your body to sweat, your heart rate to rise significantly. Okay? All right. Next slide, please. And then the final major threat to liver problems is drug-induced. There are drugs that we take into our body that can cause the liver to be unhappy and inflamed and injured. There are a lot of herbal problems. The problem of herbal medication is not bad, no. But unfortunately, in our part of the world, people are mixing all kinds of things, selling all kinds of things, and they get market. They themselves know. They know that what they are doing, what they are selling, has nothing in it. They just cut some things, blended some things. It looks very bubbly and sumptuous. They say this is a tonic, a bionic tonic, cleansing, liver cleansing, kidney cleansing, body cleansing, everything cleansing. It cures everything in the world. Super. And yet they are poor. They are selling the thing right here in Ghana. I'm telling you, if you had anything like that, that really works. The difference between the whites and us is that before these things are put on their market, they scrutinize it well. Unfortunately, there are regulatory problems that puts the consumer at risk. So if you are in this environment and you are a consumer, we are all consumers. We are all at risk because somebody even goes to the farm, harvests plantain, and there are chemicals to ripen the plantain. That plantain must be sold. He has to make quick money, and that money is what they are concerned about, not your whatever the health consequences of that. Nobody cares. Elsewhere, they are able to track every batch of plantain on the market. They have ways of tracking it. They batch everything and they can track it down and they know everything that's going on. But unfortunately, we are not there yet. So the question of the herbs problem, I can't sit here and say that, oh, all herbal medication is bad. That one is not true. There are some that are good. They've been tried, they've been tested, they do good stuff. But there are a lot more that the source of it, if we should trace it back, you will be surprised where it came from. You'll be surprised. And somehow people are very, very, very willing. They willingly offer their bodies, their livers and kidneys and everything to be used as experiments. After that, they pay for it on top. They pay for it. To I swear. So please be careful. Because of the streets are not safe, the things that is going on, we are the other side, we are seeing the things that are going on. It's not good. Don't be very, very vigilant and make very good decisions. Now, I've talked about herbs, but there are drugs that your doctor can give you that can also cause liver inflammation. You had a sore throat, very bad cough, and you needed antibiotics. There are some antibiotics, yes. When you start taking them, the liver also reacts. We call it drug-induced liver injury. We cannot always predict who gets that. And when we see them, we stop them. When we stop them, the liver goes back. There are some treatments that you cannot stop. Somebody has cancer, some cancer treatments. If you stop taking the treatment, you will die. So that one, you can't do anything about it. We march on. Unless it's at a certain threshold, we continue. So yes, some treatments we've talked about herbs, but some treatments that your doctor can give you, sometimes even for cholesterol, some of these drugs can also cause liver injury. And if you are doing these tests, yearly, you spend some few Ghana cedis. Just go and then check your body, do a few tests. These things come up, and then we look back. Is there anything that you are doing that may be causing the liver to be unhappy? Once we see them, we usually reversible. Okay, all right. Next slide, please. So we'll be ending with four things that you can do to maintain good, healthy liver. Just 4 things. So know your baseline, know your liver health, know your baseline. It's always important. Once a year, you should pay some small amount of money and then get a full check. Give your doctor some money. Let him check your body. Okay. Discuss your risks. Okay. My mother has hepatitis B. I take so and so drugs. Just discuss. The doctor will examine you, and then we'll order screening tests. Screening. Let's just screen your body. What's going on? Have you ever been screened for hepatitis B infection? Have you ever been screened for hepatitis C? These are the common threats. Okay. But how much alcohol are you drinking? So I drink 24 bottles a week. Doctor say, no, it's not good. All right. So it's important to know your baseline. We do a liver function test, liver scan, but we'll add other things, check your kidney, check your diabetes. All these things also are part of your body, and we need to know how your body is doing. So know your baseline. All right. Next is the second thing to do to help you maintain a healthy liver. Next slide, please. Is that avoid liver toxins. Okay. Very low or no alcohol. So alcohol is a very common toxin. Herbs, some drugs, supplements. Yes, some supplements you are taking have some components that are also problematic. So, and usually it is only through screening that will pick up some of these things. Okay, if you are just doing screening, the liver can maintain function. Even though it's hurt, it will be maintaining normal function. You may not see any symptoms, but sometimes screening will just pick it up, and then we will trace it back. Say, oh no, your liver doesn't look happy. What's going on? Then we start asking questions, and most of the time we're able to pick up some of these things. All right. The next thing, number 3, is that the common things are common. Hepatitis B and C, they are very common in our part of the world. Get immunized if you are not immune. I've mentioned, some of you joined late, that hepatitis B can only get into the body of a person who is non-immune. Some of you were immunized in the past, but that immunization didn't work. Check your immune status today. Some of you have never been immunized before. You've never had hepatitis B before. The virus is looking for you. It's looking for you. It's trying to find you. When it finds you, it will be in your body. It will try to be chronic because it loves being chronic. Okay, and it stays with you forever. Sometimes it's not a very bad relationship. Other times it's a very bad relationship, and you need to deal with it. Now, if you are positive, get treatment. Okay, your doctor will do further tests, but you need to be followed up. Some people start well, and then along the line, the virus changes. So you need to have yearly follow-up when you have hepatitis B, 6 months to 1 year follow-up. Okay, and then finally, exercise, eat well, eat proper things, proper food. Okay, fruits, vegetables. Okay, every day, get an orange in, get an apple in, banana, whatever. Exercise, work out. It's so important. Overweight also pushes a lot of metabolic pressure on the liver. If you get diabetes today, it pushes you to get non-alcoholic fatty liver disease. So reduce your risk by just being healthy, all right? Being a healthy person, do what you can. There are things that we cannot avoid. I mean, we cannot prevent 100%, but there are a lot of things that are within our control. Let's focus on those ones. Okay, regular exercise, regular diet. So I'll end here and take questions if you have any. Thank you for listening.
Thank you very much, Dr. Kwaffo. This has been very great information. We'll be taking a couple of questions. Yes, I see a couple of people have their hands coming up. We also have some questions in the chat box. I'll be with you very shortly. But even before we go on to the questions, I'd like you to know that SYNLAB Ghana has a number of branches all over. Okay. Within Greater Accra, we have the head office at South Legon. We have a branch in Roman Ridge. We have a branch in Shiashi. There's also a branch in Tema, just across the street from the Tema General Hospital. Okay, we have branches in Bantama, Ahojo, in Ashanti. There's a branch in Kolibu as well. That's still within Greater Accra. There's a branch in Sunyani. There's a branch in Koforidua, Takrade. A couple of them in Western region, Ifekuma, Chapel Hill area. Then we have one in Takwa. We have one branch in Tamale. There's a newly opened one in Cape Coast as well. You can reach our call center on 0302 763580. So I will get a number of us to bring in our questions. Let me take one or two from the chat box. Okay, William says there's someone who took 2 doses of hepatitis B vaccine way back in 2018. She still not received the 3rd dose, and he would like to know what the implication will be for the person and what the way forward will be as well. Then Samuel also says that he did a hepatitis viral load, Hep C viral load test, I think with SYNLAB, and then the results, according to him, came out negative to the lowest of 0. I'm not sure what he's driving at, whether it meant that perhaps there was nothing detected there. He wants to know whether he's free of hepatitis C. So another person, Benjamin is asking whether a hepatitis B, someone who has hepatitis B infection can get married. So, Doc, you can kindly take note of these questions, and maybe you can address them, and then we'll come to those whose hands are up, so we can just pick a couple more.
All right. So, if you got vaccinated for hepatitis B, against hepatitis B, 3 shots would sort of guarantee lifelong immunity. Some people take two, unable to take a third one. The reason why we do that, the three, is that yes, even if you take one shot, you get some immunity, but it's to strengthen it and to make it a complete, robust immunity. We do the 3 shots. Some will do a regimen of 2, and then 6 months down the line do the third one. Some will do the 3 months apart. Now, if you do 2 and you haven't done the third one, you may have immunity. You may have immunity, but along the line, it may wane, especially after about 10 years. The immunity begins to go down. So I would say that that person should check their immune levels. Okay, you go in, you want to know your hepatitis B immune levels. They will call something surface antibody. Okay, once that comes back and it's normal, then it means that the immunization, the 2 worked. Okay, they can quantify the level and say that, oh no, your levels are, when anything less than 1 in 10 is inadequate immunity. All right, and for that you have to get a booster. Okay, usually they will add the third one. Sometimes, like I said, it didn't work at all. In that case, you have to start afresh and get the 3 shots. Now, hepatitis C. The test we use to screen for hepatitis C is called, the antibody, hepatitis C antibody. Now, a lot of people, that test cannot tell apart somebody who has hepatitis C actively, that is now has hepatitis C. They cannot tell it apart from somebody who has had it 10 years ago, because I mentioned that Hep C is chronic. Some people get it and they get immunity from it, and then some people get it and they get a chronic infection. So we do the viral load for hepatitis C to know, do you have active infection or not? Once that test comes back negative, then you do not have hepatitis C. Then the final one was that, can someone get married? Of course, you can get married with hepatitis B. It's not even something to consider that because you're hepatitis B, no one should discriminate against you at all. However, if you are getting married and your partner has hepatitis B chronic and you are non-immune, remember, it is only those who are non-immune who are at risk. If you are immune, forget it. You are okay. And how can you become immune? You can get vaccinated, as simple as that. So it's not a problem at all. Okay. All right.
Right, thank you very much, Doc. So you can pass by any of our branches to get screened for hepatitis B or hepatitis C. Now, Madam Doris Kwatima, you could kindly unmute and then let us know your question.
All right. Thank you. Look, please, I've been diagnosed before with hepatitis C. And back then, I think about 15 years ago or something, I did the vaccine, complete one. But after I did the test and I was diagnosed with hepatitis C, I was a bit confused because I thought I've done the vaccine. And so there was no need for anything like this to be, And later that I did a viral load that time. I think that was back then in 15 years ago. Yeah. I did a viral load and it was non-reactive. And again, afterwards, I think I've been going to the hospital, and anytime they do a test on me, it shows positive. But I went to SYNLAB, yeah. I think I went there and then I was asked to do the viral load. So I went there and did it. And it's, again, non-reactive. I think about it's almost a year now. Yeah, I think almost, or let's say roughly 6 months ago. So in my case, I want to know that since I've done the vaccine, a complete vaccine, and just as you are saying, you can have the vaccine and maybe it might not work. So do I have to do a different test for the hepatitis B, and at the same time, hello?
Yes. So let me see whether I got your question.
Yeah.
Did you say hepatitis C for cat or B for boy?
Okay, I did the B. Like I did the B vaccine, the complete vaccine. That's for the 3 shots. I did. Oh,
Yes.
I took it, and then
Yes.
later I went to the
Yes.
hospital. I think I had a fertility issue, so I went to the hospital and they were doing this test, and they realized like it came up that I have C. I am positive for the
You
C.
had C. All right.
Yes.
So let me answer there. So I mentioned earlier that hepatitis B, there is a vaccine for hepatitis B, but there is no vaccine for hepatitis C. So you can be
Yeah.
immunized against hepatitis B, but you may acquire C. Okay.
Oh, okay.
When you get the vaccination for hepatitis B, there are 3 injections in a row that would offer you lifelong immunity. But unfortunately, hepatitis C has no vaccine to
Vaccine.
prevent it. But there is cure for hepatitis C.
All right.
However, most
So
people get screened with hepatitis C antibody test. But that test, if you are positive, it does not confirm it that you have it in your body. It just tells that you've been exposed before. So if ever you are positive for hepatitis C, you have to do a further test to confirm it for sure.
yeah. Can I continue?
Please continue.
Okay. So after my test with SYNLAB, I think from the Ridge Hospital, so I was told I should go and do the viral load. I went and did it, and it came again non-reactive.
Mhm.
So in this case, I want to know how is it going to clear from my system so that any test or any further test that I do won't show up as positive, just as you are saying that have been exposed. Because I thought there was a team of doing that,
Are
like
you
putting
referring
out
to
on
B or
drugs.
C?
The C,
The C,
the
okay.
C, yes,
Mhm.
the C. I did a
Ah,
viral load and it was non-reactive for the first one. And then the
yes,
second, recently one, I just did it and it shows non-reactive.
yes. If the viral load for Hep C, the viral load for hepatitis C is the confirmatory one. That is what confirms. So if the viral load is negative, then you do not have hepatitis C. Okay, you may have positive antibody tests to hepatitis C, but if the viral load is negative, you do not have hepatitis C.
Okay. But how will it be cleared from the system? Because
You don't have it in the first place, but
okay.
it will always be positive because you have been exposed to it before. Okay, it's an antibody.
Okay.
Anytime you get a germ into your body will produce some chemicals we call antibodies, it gives an evidence that there's being germ around. Okay, there are some
All right.
tests that will always be positive. You cannot clear it. You have had an exposure, but do you have the
Okay.
disease? No. So you do not have the disease. You should just be aware of it and don't sweat about it. That's how hepatitis C is. Okay.
Oh, okay. Okay. Thank you. And so it means I still have to be doing the test over and over. Like
No,
just you're saying 6 months after, yeah.
no. For hepatitis C, it tends to be a chronic thing. But that's one by
Okay. 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 Okay.
once you have done the
Uh,
viral load and it's negative, you do not have hepatitis C.
all
You don't
right.
need to repeat it several
Thank you.
times.
Can we have
All right.
Mohammed
Thank you,
Sheikh
Doc. Thank you.
Ahmed ask his question? Mohammed, could you please ask your question? You can unmute and ask your question. Thank you.
Hello, good evening, Mr. Julius. Good evening, Dr. Kwaffo, and all of you. It's nice to have you here, putting on this great information to the public. In fact, I have 2 questions, or maybe the other one is going to be like um, just for you to bring to people aware of what is really happening. Number one, my question is that can hepatitis B positive patient donate blood? That's number one. Number two, I would like either the organizers to please kindly emphasize on trying to people should visit accredited laboratory to do their own testing. Somewhere 2020 at the Kwaffo branch, we had one of the patient walked in and he came to collect his own reports. He has been treating the hepatitis B for a while. According to him, he said he was diagnosed from one of the facility and they told him he's having hepatitis B. And after taking the medication, also he went back and still is showing positive. So when he was referred to SYNLAB to run the test, and appeared to him that the doctor told him that he's not having hepatitis B. So I would want you to kindly please emphasize on that for people to visit accredited laboratory to do their own testing instead of leaving themselves dying, going to the facilities that are not well equipped and they don't have machine that can be able to dictate the virus appropriately. Thank you so much.
Thank you very much, Mohammed. Thank you. So, I mean, you highlighted the point that I had to, I wrote down because it's something that I wanted to talk about, but escaped me. So, your first question is that can somebody with hepatitis B donate blood? If you should get blood from somebody who has hepatitis B, you will surely contract hepatitis B. It is transmitted through blood. However, if you go to donate blood, they will check the hepatitis B status of that blood. If it is positive, that blood will be discarded completely. Usually, the blood bank would give you a call to let you know that, this is your status. We cannot use the blood. Thank you for donating. You shouldn't bother to donate more blood in the future because by protocol, anyone who has any blood that is tested positive is not used, is not added to the pool of viable blood transfusions for patients. We do not use some blood that tests positive for hepatitis B. So don't even bother if you have hepatitis B. You are aware you have hepatitis B. You cannot, even if you decide to go and donate blood, that blood will not be used. Okay, it is part of the screening protocols because we are trying to prevent the transmission of hepatitis B, and part of it is that we need to screen all. And these are things that are done. They've been running in the system for over 20-30 years. Earlier in the 1950s, 1960s, when it was not very common, it was one of the ways you can acquire hepatitis B through blood donation or blood transfusion. But within the last 30-40 years, our screening systems are very sharp and we discard completely any blood that is positive. We do not add them to the pool of blood to be donated. Okay, so if you go to hospital and you need blood donation, don't it's very unlikely, highly unlikely that blood has not been screened for hepatitis B. All right, now the point that you highlighted, which I should bring about, is that sometimes a lot of people, because of lack of understanding, you have hepatitis B and you are so worried and so broken by that information that you are going round and round and round looking for cure. I've already explained to you that hepatitis B is not curable. If you test it 100 times, it will be positive. Now, even when we put you on treatment, we put you on treatment not to cure you, we put you on treatment to suppress the virus and to make the virus inactive so that it does not hurt you. just like HIV virus, we cannot cure HIV virus because hepatitis B and HIV have a very special formula. They are able to enter into your, so unless we kill you, unless we take away your liver completely, we cannot cure it because it has entered into your DNA in a very special way, beyond which no medication can eliminate. So we are seeing that people are running helter-skelter, so broken by the information of a positive test to hepatitis B, and they are searching for that elixir that will just wash it clean and make them live forever. Please, it will not happen. Okay, the science is, we haven't reached, the medical science has not achieved that feat yet. From years ago, there were liver supplements, liver 52, this, liver tonic, this, liver that, and every people are taking it too. If the goal of taking those, I have nothing against those things. If the goal of taking those things is for cure, then you are misinformed. Okay, you are misinformed. So just be aware of that. Thank you.
Okay.
Right. Doc, thank you. There's a question related to the response you had given about the blood transfusion. So maybe if you could just kindly touch on it, has to do with someone with hepatitis C and whether they can, go and then donate blood. So if you could kindly touch on that. So once you are done with that, I could have the next
question.
So yes, I mentioned that hepatitis C is curable. One, hepatitis C, the screening test is just a screening test. You have to do you have to go a further step to see, is this a true positive or this is a false positive. So hepatitis C is more of a special situation because the screening test for hepatitis C, once it's positive, it does not necessarily mean so. You have to do a confirmatory test. So still, we have, when it comes to blood transfusion, there are very, very strict rules because our health system, nobody wants to come and get sued for wrong transfusing somebody with contaminated medication. So the transfusion blood banks is so robust and it's been going on for years. It's been running for years. We screen blood thoroughly for hepatitis B. We screen for hepatitis C as well, HIV. We confirm, okay, they are confirmatory tests to ensure that, yes, this is indeed negative. So if you have hepatitis C, is it true hepatitis C? Have you done the confirmatory test? If the confirmatory test is negative, then you can have transfusion, okay? But if the confirmatory test is positive, you have to seek treatment because it is curable. It can be treated. Once it clears, it's possible that you can have transfusion. Okay. All right.
Right. Thank you so much. Ladies and gentlemen, we have a projection of the branches, the various branches of SYNLAB on the screen. You can kindly take a shot of that so that depending on where you are in Ghana, you can pass through, get yourself screened. Can we have Princess Yaba unmute and then ask your question, please?
Okay, thank you very much. Please, I want to ask a positive hepatitis B positive mother, maybe after delivery, maybe was able to give the immunoglobulin to the kid, the baby. I want to find out if that baby is protected for life or the baby at some point in life will have to now go for the other shot, the 3 shot. At birth, the immunoglobulin given, how long can it sustain the baby, and when would the baby need the 3 shot? Then I want to also ask about any nice medication that can keep the liver healthy. Once we can't treat it, we can't cure it, maybe there's any nice medication that is a very good liver support for us. Thank you.
Okay. All right. Very good question. So we do not only give immunoglobulin, but we also give a vaccine. So the package that is given to a child whose mother is, or a baby born whose mother is hepatitis B positive, is the immunoglobulin, which should be given as soon as possible, because the immunoglobulin is just like antibody that will try and neutralize anything that has anything that is trying to enter into the baby. So you are just trying to neutralize it, whilst you give the vaccine to start the baby's own immune system to produce antibodies for. So we do immunize, because the immunoglobulin will just work for a few days. Immunoglobulin works for a few days, so days. It's just for interim protection. But we actually go ahead to vaccinate that child. There's a program to vaccinate that baby. Fresh born baby must be vaccinated, at birth, to provide immunity, lifelong immunity. Now, but for a child like that, yes, I would say after 10 years, it will be good to check your antibody levels and then get a booster if required. But that immunization giving should be enough. So it is not just immunoglobulin, it is immunoglobulin plus vaccination. And that vaccination should give lifelong. If you only give immunoglobulin, you are not adequately protected. You are not adequately protected. Now, you don't need any supplement again. If you have hepatitis B, you do not need any drug, booster, liver cleansing, liver cleanser, liver whatever. You don't need anything. If you have hepatitis B, we have to monitor you for life, meaning that every 6 months to 1 year, we evaluate how is the relationship between you and hepatitis B. Is the relationship still cordial? Is the virus behaving itself? Is it under control? Once it's under control, everything that applies to everybody applies to you. The exercise, the lifestyle, stay hydrated. Don't be taking this, eating rough, eating late. Don't, be taking herbal here, herbal there. The only thing that would cause that virus to turn against you would be if your immune system should weaken. So yes, anything that will boost the immune system is a friend of your liver to keep the viruses down. But that can work with, eating right, fruits, vegetables. So you don't need any special booster or anything. All right. So you don't need any new medication. I'll just say that just live a healthy lifestyle and do not get HIV, because if you get HIV by nature changes the nature of hepatitis B. If you get HIV, hepatitis B becomes more aggressive. HIV will weaken your immune system and will allow hepatitis B to flourish. But it also changes the two of them. When they come together, they change the nature of the disease, and you are likely to progress compared to somebody who does not have HIV. Thank you.
Thank you, Doc. Can we have Balson Titusson unmute and ask your question? Thank you.
Thank you very much, Doctor. I've already sent my message on the chat box, but a friend of mine tested positive. That was like 2010, thereabouts. And since then, he has not been on treatment. But recently, he ran the test for viral load and the profile at SYNLAB. And the viral load was 176. And it's non-replicating. So his concern is whether he's still to go in for treatment or he's fine to go.
How old is your
That's the
friend?
question. He's 31 now, 31
Yeah.
years now.
So if it's not replicating, means that E antigen is negative. Viral load 176 that's low, if the liver function test is fine, ultrasound is fine, then that person does not need treatment. He will not benefit from treatment. He can decide to take the treatment, but it will not help him. He's just putting some chemical in his body. It will not change the outcome. It's not likely going to change the outcome. Remember, I said that we put all this information so that we can categorize patients into two groups. Are you the type that the virus is hurting, for which reason you will benefit from treatment? Because if we do nothing, it will worry you. Those people are in the minority. Now, are you the type of person who the virus is just living in peace with you, coexisting nicely, your immune system is strong, has kept the virus in check, for which reason, even if you decide to take the treatment, you will not get any benefit from it. So save your money and save your body. That's all. You don't need it. It will not change anything. You are taking it for taking sake.
Okay. The last question: is such a person allowed to travel? Will be granted the opportunity to travel in case that evolve because of his status?
Yes. So there's no travel restriction when it comes to hepatitis B. There's no travel restriction. No one should be discriminated at all. Usually, sometimes when non-medics handle these things, they might send it to a doctor. The doctor will do the same determination to say that no, yes, you have hepatitis B, but we are advising everyone should get immunized or get immunized. So you're not a threat to immune people. You may be a threat to non-immune people, but yes, we do not discriminate. Travel is not a problem when it comes to hepatitis B. It's not something that they even screen for when it comes to travel.
Right.
Great. I'm grateful. Thank you.
Thank you. So I'll take a couple more questions from the chat box. So Doc, I'll go through a couple of them and then you can respond to them. Then I can come back to those whose hands are lifted. So Kwesi Nyameche says, please, what should be the time interval for repeating the dosage? I would imagine that Kwesi may be referring to the vaccination. Then Adam Samuel says, Doctor, can you take more than 3 jabs? Let's say 5. Then we have Richard Nanabrakwa saying, can both Hep B patients get married and give birth safely? So Doc, maybe you can look at these 3.
All right. So time interval between vaccinations, the first shot, between the first and the second, 1 month. Between the second and the third is also 1 month, but can also be done after 6 months. So between 1 to 6 months, you can do the third one. So that's the recommended. Some protocols will do it month after month after month. Earlier on those days, we used to do it first month, second month, and then 6 months you do the third one. But we realized that it was creating a lot of problems. People never came back to finish up, especially when they traveled. So these days we just do the 1 month. Can you take 5 vaccinations? Why would you do that? I mean, would they have any negative effects? You are giving antibodies. You are just trying. 3 would do the job. The other 2 will be supplementary and not important, not necessary. So they are just it won't work. So there's no need for 5 vaccinations. If you did take 5, I'm not sure that will harm you. Your body would have produced enough antibodies. They will just neutralize it. It will just be a waste of injection. All right. Can 2 people with hepatitis B get married? Of course. Can they give birth safely? Of course. As long as the baby is immune. Remember, the threat of hepatitis B is to non-immune people. If you protect your child adequately through immunization, that is not a problem. So yes, you can give birth safely. 2 hepatitis B parents can have a child who is negative because that child was given protection. So that's the reason for all of this World Hepatitis Day. We're trying to create awareness. Okay, if you are positive, no problem. Let's check and make sure that you are okay. If you need treatment, we'll give you. If you are negative and you're not immune, no problem. Get immunized and protect yourself. So if everybody, every Ghanaian, or all the non-immune Ghanaians got immunized today, and we continue to ensure that every child born is also immunized early, then in the next 30, 40, 50, 60 years, the last hepatitis B patient, when the person dies, would have been able to control hepatitis B.
Great, thank you. Can we have Kamisel Jojo Saki unmute and then ask? Jojo, can you please unmute and ask your question? Hello, Jojo. If you can hear me, could you kindly unmute and ask your question? All right, let's have Foster Osei. Foster Osei, please unmute and ask your question.
Oh, okay. Good afternoon. Please, my question is that somebody who has been diagnosed as a hepatitis B patient, and the profile indicates that the person is having like non-duplication, but still, can it be infectious? And my second question is that, for example, when such a person visits SYNLAB, and maybe without any doctor's recommendation, but he goes there and take the other test that you are talking about, do you have the personnel to give the person, maybe interpret the results and recommend maybe a decision without necessarily going to the hospital? Thank you.
All right. So somebody who has E antigen negative hepatitis B, that is, you have a non-replicating. Okay. Yes, you are still infectious. Okay. You are still infectious if you have non-replicating chronic hepatitis B. You are still infectious. The virus is still present within the blood. Okay. So yes, you are still infectious. And then the question was that if you walk in, of course, you can walk in SYNLAB. SYNLAB has a clinic in there called SYNLAB Clinic. There are doctors, very good doctors who are there. I also go there a couple of times in a week. If you ever need to speak to a doctor, yes, we've got a clinic right there for interpretation of labs and giving medical advice, treatment. Yes. Also, if you are outside Accra, you can arrange for what we call a telemedicine consultation. You can sit in the comfort of let's see, where Goso, if you're Kuma, wherever you are, Cape Coast, and you want to talk to one of the doctors at the SYNLAB clinic, they could arrange that for you. So I think, viewers, you can share the contact for the SYNLAB clinic at the end, so that anyone who so desires can contact the doctors there, including myself.
Very well, thank you. Maybe a few more questions. Gifty Dombawell says, please, I am a Hep B positive, and the doctor told me that it's not in my liver, but it's in my blood. Is that possible?
Yes. So, I mean, the the virus goes to sit in the liver, and the liver is where it operates. That's the Jubilee House. Okay, the liver is the seat of government for the hepatitis B virus. So it is always in your liver, but it is blood-borne. It's the liver would, that is where that's a factory, that's where the new viruses are being created. When they create them, they hit the liver, the liver breaks up into small tiny pieces, some of the liver cells, okay, and it is released into the blood. So yes, you have it in your liver, you also have it in your blood, but the liver is the source. Okay, that's where the virus always ends up and stays. That's a sanctuary for the virus.
All right. Do we have Jojo Saki on now? Jojo, if you are on, kindly unmute and ask your question.
Thank you very much. Please, my question is that I've been diagnosed of Hep B and Hep C for like more than 10 years now. I didn't do viral load initially, but they started me with lamivudine. So, but subsequently, I did viral loads like 3 times for the Hep B. It tells me that not detected. And I did for the Hep C too. That one too says not detected. But recently, the last time I did the profile, I was told that my body has both antibodies to the Hep B. But so I don't know whether like, am I cured or what? That's the question I'm trying to ask. Whether like, am I cured or what?
Okay, all right. So it's a very important question. This will probably highlight. Did you do it at a very good lab? Jojo.
Yeah, I did. I did all at SYNLAB. The first one I did wasn't at SYNLAB, but the subsequent ones I did was at SYNLAB. And all of it tells me that not detected. But the profile that I did.
Yes. So the viral load was not detected. Now, did the profile tell you that you have hepatitis B? Because we make the diagnosis from the profile, from the surface antigen tests. Was that one positive?
Yes. What? Yes, but because I saw a change. I saw a change on it. That the way it is written HBE, AB. That place changed now to be like positive. And then I was told I've both antibodies to it now, so it's good.
No. How about the HBsAg? HBsAg. So you know what? Yeah.
If you can hold on for me, I'll just quickly check that.
All right, that's fine. Yeah.
Hello?
I will send you the contact. Do you have it?
Please just hold on for me.
Hello, Doc. I think I'm going to share the
question you asked
number.
Was what about which? Hello?
Yeah, go ahead.
Jojo,
do you have the information now? Otherwise,
yeah,
I'll share the clinic number so that.
Yeah, I have the information now. I have the information now. So I wanted the doc to give me what he asked for, so that I'll just see it again and tell him. The HBsAg is positive.
Yes. HBsAb
is positive, and then the surface antibody.
Surface antibody is
HBsAb.
Surface antibody.
The surface antibody is negative.
Yes. So what it means,
surface antibody is negative, but the HBs, The 8BSAG is positive.
Yes, yes. So I know
And then
this.
the surface body antibody is negative.
Negative,
And then
yes.
the 8BEAB is positive.
Yes, yes. So what it means is that,
negative.
yes, what
And
this means.
8BCAB is positive.
Yes, what it means is that, yes, you do have hepatitis B. As long as the surface antigen, okay, is positive, you do have hepatitis B. However, because you were on antiviral medication, you have suppressed the virus. The medications have suppressed the virus to an undetectable level. Now, undetectable does not mean negative. They are choosing their words very carefully, because the machines that has a range below which you cannot quantify. Okay, it's there, but it's just undetectable. It's so low that it is not detectable. So from the profile you have read to me, yes, whether you met criteria for treatment, that's another situation, because I don't know about it. Lamivudine is a very interesting choice. We do not use lamivudine as a treatment option any longer, because usually it builds resistance very, very, very easily. So, I mean, you should probably go in for a review so that your doctors talk to you. Okay. All right. So that was a good question.
Thank you. So I'll take the final question from Owen Sakoto. I'll take the final question from Owen Sakoto. You can unmute and then ask your question. Thank you.
Okay, good evening. Can you hear me, please?
Yes, we can hear you loud and clear.
Okay, so I've had this hepatitis B for, I think the first time I did the scan was in 2009. So I've been living with it since. I've been doing these checks every now and then. I started somewhere in 2021, where I was doing 6 monthly checks and everything was fine. Somewhere last year, I went to SYNLAB. I did the scans and returned that everything was fine. As in, the viral load was below, 700 copies, with HBsAg being positive, HBeAg being negative, then the antibody, HBeAg being positive.
Yeah.
I did the scan somewhere May this year, but the viral load has shot up to over 2,000. We're above 2,700. I've started, the doctor advised that I start with tenofovir. So I want to know whether at some point I can stop that, or I have to do the follow-ups with the doctor before I can proceed with stopping with that treatment.
All right. So you need to do the follow-ups with the doctor. Now, this is exactly what I was referring to. Sometimes the virus changes its behavior, but it's not always necessary to sort of, as a knee-jerk reaction, the moment it gets to 2,000 something that we just start. No, there are other things that we put together. So we always want to know, yes, what's the viral load? But would it happen in 3 months' time? We can do it again. Is it rising? If it is rising, somebody who's had a low viral load all this while, and then suddenly we begin to see that, no, it's trending upwards, 2,000, the next one, 5,000. Then the virus has changed its nature in some way. We also look at the liver function test. Is there any sign of inflammation? Sometimes we even go for a biopsy, and then we see. So once doctors...
Okay, a quick one. I did the scans, abdominal scans.
Yeah.
The report that was given, everything was perfect. But when it comes to the liver function, between I think I started in somewhere 2021. Between that 3 years or 4 years interval, the last one that I did recently, where the copies are way over 2,000, I can see some of the parameters were way over the normal limits.
Very, very good. So yes, so in that case, your doctor has made a very good decision for you to put you on medications to suppress the viral load. So I agree 100%. If there was some abnormalities in your liver function test,
ALT was a bit high, though mildly over the normal limits. Bilirubin, I don't know whether that is the right, was also a bit way above the normal limits.
Yeah. So I would just say that your doctor knows what he's doing. Work with your doctor. Okay. Now we want to keep we want to continue till it is undetectable, and we keep it there. We do not just stop the treatment because usually we can't cure it, but once you stop, the virus would necessarily go back to its baseline levels. If it is changing like this, I would say that yes, we should continue to keep it low and suppressed in the long term.
Okay, thank you.
You're welcome.
Thank you so much, Dr. Kwaffo. Very, very insightful indeed. I'd like us to know that the recording for this webinar will be available on the SYNLAB Ghana YouTube channel, so you can always get back to it, and then ask others to also go use YouTube to link up with SYNLAB, and then you can go through it all over again, because there are deep insights that have been shared here. I'd like to share the SYNLAB clinic number. The SYNLAB clinic number is 025 799 9009. That's 025 799 9009. And then the contact center number is 0302 763 That's 0302 763 You can contact us, and then we will be happy to assist you, whether for the clinic or you want to get in touch so you can do your screen or your viral load. Thank you so much. Dr. Kwaffo, do you have any final words to share?
Yes, so the final words would be that if you're non-immune, we are targeting those who are non-immune. If you're non-immune, get vaccinated. If you have it, no problem. Just talk to your doctor. We'll do the necessary evaluation, categorize you. Do you need treatment? Do you not need treatment? So we'll continue to monitor you. Keep staying healthy, exercise, eat well, take it easy, low stress. I'm surprised the alcohol was not an issue, because usually always the alcohol is an issue. Those who are who feel their freedoms are being restricted would always fight back. So I'm glad it didn't come. I think you guys are all Sunday church people, so it worked out well for me. All right, so thank you all for joining, and
hopefully we'll meet another time. Bye. Thank you so
Bye.
much.
Thank you.
Thank you so much. God bless you.
Thank you, everyone.
Thank you.
Bye.